Okay, Mr. Rogers, I just wanted to go over a few things before I head out for the day. The first thing that I wanted to go over was your pain medication. It's really important that you do ask your nurse before we do a wound change on the diabetic wound on your right heel, that you do ask for pain medication before that. Now, we are cleaning and making sure that your wound is free of infection during this dressing change. However, it can be a little bit painful, so just to give you some more comfort, it's really important that you ask for some pain medication before that procedure. The second thing that I wanted to go over with you is it's called guided imagery. Now, I know that you are receiving other pain medications for your pain, but another non-pharmacological intervention to reduce some of that pain is called guided imagery. So what I want you to do is close your eyes and picture your favorite place, or picture the beach, wherever makes you happy. And just think of this place for a while with your eyes closed, and this kind of helps focus your mind on that happy place instead of the pain that you are feeling. The second thing that I did want to talk to you about was your blood pressure medication. So some blood pressure medications that are ACE inhibitors can cause a dry cough, and this might be why you are experiencing the cough that you have right now. So what we can do is speak to your healthcare provider about possibly switching medications for you to start taking your blood pressure medication at home. That's different than an ACE inhibitor. Secondly, I did want to speak to you about your enoxaparin and why you do receive this. So we are giving you a low molecular heparin. It's a blood thinner medication. It's called enoxaparin. So while you are here in the hospital and laying in bed and not ambulating as much as you usually do, this prevents blood clots. So the more that you are stagnant, it causes venous stasis, and it could possibly form a blood clot like in your legs and stuff. So it's really important that we do administer you this medication so we can prevent that from happening. So can you tell me why we administer your enoxaparin every day? Prevent blood clots, yes. The third thing that I did want to talk to you about was using your incentive spirometer. So as you are laying here in bed, it's really important that we keep the alveoli in your lungs. These are the little things in your lungs that kind of help you breathe and exchange the oxygen, CO2 in your lungs so that you are able to breathe. So this little device is going to help expand those alveoli so we can prevent atelectasis or any other respiratory infections. So I'm going to show you how to use the incentive spirometer, and can you show me how to use that back? Okay. The fourth thing that I wanted to talk to you about was increasing fiber and protein in your diet. So the fiber is going to prevent constipation. So foods that are high in fiber are going to be like your fresh fruits and vegetables, and your protein are going to be like your legumes, your meats, and chicken. So we want to increase that because protein does help increase the healing process that will help your wound heal a little bit faster. So can you tell me the two things that you want to increase in your diet? Protein and fiber. Yes. Okay, and so with a diabetic diet, which is what you are on, it's really important to be strict on your diabetic diet so that we can get your blood glucose under control. So I'm going to give you a pamphlet and a brochure on foods that are low in carbs. You want to make sure that you are counting your carbs. So if you do have any other questions regarding this, I will refer you to a nutritionist consult, and she can go over it in depth with you about foods that you can and cannot eat, because we do want to get that blood sugar under control so we can prevent other injuries like the diabetic wound that you have and also the high blood sugar readings. It's also really important that you want to increase your fluid intake. This is going to also help prevent dehydration. It's going to prevent constipation, a bunch of other things. So it's really important that you continue to drink fluids, drink water and juices and stuff like that, as long as they're not high in sugar. The third thing, or the fifth thing that I wanted to go over with you is just getting up and moving around. So I know that you do have the wound on your heel, but it's really, really important that when you are up and walking around, it kind of gets your muscles moving and your blood flowing. So even if you do range of motion exercises in the bed, that is an improvement, and we want to keep doing that. Also, for when you go home, it's really important that you find shoes that are going to be your right size, because a lot of the times with diabetic patients, they can't feel their feet as well anymore, and so this is how little cuts and scrapes can turn into big wounds, and we want to prevent that from happening. So as we're laying in bed, it's also really important to turn and reposition yourself every 2 hours. So the more that we lay in bed on a certain spot on your skin, the less oxygen and blood flow is going to get to that point, and it can cause further skin breakdown. So it's really important that we want to turn and reposition ourselves to prevent that from happening. So can you tell me what we have to do every 2 hours to prevent a pressure ulcer from occurring? Turn and reposition, yes. Okay, so I wanted to go over one more thing with you. It's about your insulin. Where do you normally administer your insulin? You said your arm? Okay, so studies have shown that it's more effective if you inject the insulin into your abdomen. So what you want to do at home is you want to take soap and water and clean the abdominal area really well before you do inject your insulin. It's going to absorb better in that area. So can you tell me where we should start injecting and rotating our insulin sites? Your abdomen, yes. Okay, and then before we administer our insulin, it's really important that we want to monitor our blood glucose levels. And at home, you could take soap and water and just clean the finger of where you want to take the sample of blood from, and then you want to prick yourself with the device. You want to wipe away the blood, and then you want to get your reading. That's going to give a more accurate reading when you are doing this at home. So can you show me the next time we have to take your blood sugar, how you do it at home? Okay. All right, Mr. Rogers, that's all I have for you today. If you have any other questions, I am all finished. Okay, so I'm going to put the bed down for the patient's safety, the rail's up, here is your call bell, and I'm going to wash my hands and exit the room.